Hello everyone and welcome to Health Elite. According to medical professionals, there are not only more than 200 different types of headaches that can be localized in various ways, but doctors also categorize these into 16 different groups. Headaches can have very different causes. Often, they even have several causes at once. For example, an incorrect prescription for glasses, neck tension, deadline pressure, and workplace stress can all manifest as a headache. Because of this, pain pills sometimes stop helping. In cases of tense neck muscles, heat treatments like infrared light can be useful, and the underlying causes of stress must be mitigated. In other instances, the cause of the headache can be found in food toxins or allergic reactions, for example, as a reaction to smoke inhalation or exposure to fragrances. Headaches can also be diet-related or even point toward a brain tumor. Before someone suffers a brain hemorrhage or a stroke, severe headaches often occur. Doctors distinguish between primary and secondary headaches. Most sufferers only know that they have some form of migraine or frequent tension headaches. Anyone who suffers from recurring or chronic headaches feels their quality of life is severely impaired. Today, we are presenting what headaches can reveal about your health. Let's go. Headaches between the eyebrows. When pain occurs at the bridge of the nose, between the eyebrows, behind the eyes, and into the adjacent areas, inflammation in the paranasal and frontal sinuses can be the trigger. This pain usually becomes stronger when leaning forward. However, this area of the head can also be affected by pain that is migraine-like or points to eye problems, such as severely increased intraocular pressure, glaucoma, or inflammatory processes in the eye. Intense tension and concentration can likewise trigger pain between the eyebrows. To make a diagnosis, the type of pain and accompanying circumstances are analyzed. The pain can be steady or throbbing, and either one-sided or located throughout the entire forehead and eye area. Headaches in the forehead and nose area can also indicate a facial fracture, such as an orbital fracture. For treatment, the cause must be definitively determined. Headaches in the forehead and temple area are among the most common types. Stress or intense concentration are frequent triggers. However, other problems such as cluster headaches, migraines, or allergies can also hide behind them. Here, the specific area of the head isn't the only deciding factor, but rather how the pain makes itself felt. Lightning-like, shooting forehead headaches can indicate trigeminal neuralgia. Severe one-sided headaches with accompanying symptoms like a stuffy nose, nausea, or sensitivity to light and heat often indicate a cluster headache. Headaches in this area can also be caused by jaw misalignment, tension in the forehead muscles, whiplash, or a concussion. Note, in the case of persistent, severe headaches with accompanying symptoms such as dizziness, vomiting, or clouded consciousness, those affected should have an emergency doctor called. Even rheumatism patients can experience severe one- or two-sided temple headaches that require an immediate doctor's visit. 3. One-sided headaches. Headaches occurring on one side can also have various causes. Often, it is a migraine or the rare cluster headache. In other cases, it involves a severe reaction to toxic substances. However, it can also be a warning sign indicating a brain tumor or a brain hemorrhage. The differences are recognizable by the specific accompanying symptoms, the type of headache, and the surrounding circumstances. In any case, a doctor should be consulted for suddenly occurring severe one-sided headaches. This especially applies if the accompanying symptoms are serious. 4. Headaches in the eye area. Problems with the eyes are rarely responsible for headaches. However, anyone who works with intense concentration at a PC for hours is more susceptible. Glasses with the wrong prescription can also be a cause. Other causes of headaches in the eye area can include narrow-angle glaucoma, inflammation of the eyelids or tear glands, or painful inflammation of the cornea or sclera. Anyone who repeatedly suffers from headaches in the eye area while working should check their work environment and, above all, the lighting at the workstation. Often, however, the headache is located in another part of the head, but radiates into or behind the eyes. This suggests that they are usually associated headaches. In these cases, the cause of the pain is often difficult to determine because it may involve migraines or allergic reactions in combination with forehead or neck tension.
We hope you enjoyed this video from Health Elite. You can find more tips, tricks, and interesting information about health on our YouTube channel. If you are new to our channel and liked our videos, please support us with a thumbs up, share them with your friends, and subscribe. We will see you again in the next exciting video.